Well, good morning, everyone, and welcome. We're excited you've joined us today as we hear from the team at the University of Texas MD Anderson Cancer Center discuss a crucial topic in the lives of Texas youth, but youth across the nation, and how schools can start to do something about it. I will be your host, Kathleen Bates. I'm the program manager for the Tobacco Youth Prevention Program, which houses the Say What program, and we are located at the Texas School Safety Center, Texas State University. Before we begin, I just want to point out some important Zoom features that we will be using during the training. Throughout the webinar, we'd like to encourage the use of the chat box to keep the engagement and conversation going during the training. So what I want you to do is go ahead and open up that chat box, and I want you to select to all panelists and attendees and tell us which part of the state you're joining us from. And if you're joining us from outside the state of Texas, we want to know that too. So, just type in there and tell us where you're joining us from today. Okay, the next feature we'll use is the Q&A box. At the end of the training, if time permits, our presenters will answer your questions. So as you have questions, please make sure that you type those in the Q&A box and we'll answer them live at the end of the presentation. San Diego, is that Dr. Victor DeNoble? A shout out to Dr. DeNoble, he's amazing. Thanks for joining us. If you find yourself having technical difficulties, please contact DJ or Shane. Their phone numbers were listed in that email you received with the Zoom login information, or you can simply use the chat box and chat to just the panelists. Lastly, access to the recorded version of the webinar will be available through the Say What website. You'll receive an email notification of when that recording is available. So let's meet our presenters for the day. Kay Wallace is a program coordinator for the Aspire program at the University of Texas MD Anderson Cancer Center. She joined the Aspire team in 2020 after previously working in tobacco cessation research. She has a bachelor's degree in both English and psychology from Texas A&M University. Ms. Shamika Johnson attended the University of Phoenix and received her bachelor's in business management. For more than 10 years, she spent her career implementing youth and adult prevention programs to reduce infectious diseases, such as HIV and STIs. She transitioned into substance abuse prevention in 2013, working for the Council on Recovery as a regional community liaison. In 2016, she joined MD Anderson as a program coordinator for the Aspire program. Shamika thoroughly enjoys and has a true passion for promoting youth prevention programs. Welcome, ladies. We're so excited for you to get started. And so with that, I'm going to pass it off to you.
All right, thank you, Kathleen. So like Kathleen said, my name is Kay Wallace. I'm a program coordinator at MD Anderson Cancer Center here in Houston, Texas. I am a Houston transplant, though. I see you guys in the chat. I see some people from out there in East Texas. That is my hometown, Tyler, Texas. So thank you guys for joining us. And like Kathleen said, if you could just add any questions that you have to that chat throughout our presentation, we'll address it at the end. But I am here today with my colleague, Shamika Johnson, and we're going to be telling you guys about our teen tobacco prevention program called Aspire. So we'll go ahead and get started. So just to provide some framework for Aspire and why we do what we do. We do know that tobacco use is related to about 80 to 90% of all lung cancers, and that it accounts for 30% of all cancer-related deaths and 20% of all deaths in our nation. As an institution, MD Anderson is completely committed to eliminating cancer, and that includes ending all tobacco-related cancers as well. So over the years, the institution has developed several tobacco-related research services and initiatives, and a lot of those are housed under In Tobacco, which the Aspire team came under last year to help us reach our goal of disseminating the program throughout the state of Texas. Now, Aspire, it has been around for quite some time. It was created in 2002, and then it was relaunched and refreshed in 2018 to include some more information about the current state of tobacco products and some new and emerging products as well. And it's still being used today as an online tool to help educate youth on the harms of tobacco and nicotine products. So like I've stated, tobacco use, we know, is very deadly. It is the leading cause of preventable disease and death in the United States. So just some more statistics about why we do what we do. Um, Last year alone in 2020, we had an estimated 50.6% or 50.6 million US adults that reported using any tobacco product. So that's about 21% of all US adults are current tobacco users. Now, we do know that cigarettes are the most commonly used tobacco product for adults, and then e-cigarettes are the most commonly used non-cigarette tobacco product. So we do know that the highest prevalence of e-cigarette use is among smokers is ages 18 to 24, and they use e-cigarettes at about a 9%, at about 9%. And over half of those young adults report that they've never smoked cigarettes. So we see teens really wanting to use e-cigarettes, and we'll get into that in another slide. But here we can see that about 2 in every 5 children are exposed to secondhand smoke in our nation currently. And cigarette smoking and secondhand smoke exposure kills almost 500,000 people in the US each year. So for every smoking related death, there are at least 30 people that are not being killed, but they are still living with a serious smoking related illness. And then we know that tobacco use is also very expensive. Each year, cigarette smoking costs the US more than $300 billion, and that includes money for direct medical costs and also money that is spent with a loss in productivity. So, like I said, we'll get into some e-cigarette data information with regards to youth and young adults. So we do know that each day in our nation, about 1,600 youth will try their first cigarette, and nearly 200 youth will start smoking every day. So that's 200 youth that are becoming regular current tobacco users each day. Now, nearly 9 out of 10 adults who say that they smoke cigarettes daily, they have first tried smoking by the age of 18. So that's about 90% of current adult tobacco or cigarette users began smoking before they were 18. Now, if we were to bump that age up to 26, we would see that 99% of current adults who smoke cigarettes first tried smoking by age 26. So this is important for us to recognize and for us to come to terms with, because the brain development does not stop until age 25. So we know that nicotine is highly addictive, and the adolescent brain is very susceptible to it as it is changing and growing up until age 25. So tobacco companies, they do know that they need to get youth hooked when they are younger, and then they will have a population to pull from and a population to give tobacco products to in the future. So some more information just to break it down a little bit more about how our high school and middle school students are using tobacco products and how often and frequently they are using it. So for high school students, about 24% of high school students report that they have used any tobacco product in the past month. And of those tobacco users, 19.6% of those high school students specifically say that they have used an e-cigarette in the past month. Now, for our middle school students, about 6.7% say that they have used any tobacco product in the past month. And then of those tobacco users, 4.7% of middle school students are using e-cigarettes every month. And so in total, that's over 3.6 million middle and high school students that are currently using e-cigarettes. And then we have some more numbers here to put that into perspective. So for high school students that are currently using any tobacco products, that is 3.65 million students that are using any tobacco products. And then of those students, that's 3 million specifically that are using e-cigarettes. And for middle school students, 80,000 or 800,000 students are using any tobacco product, and 550,000 are using e-cigarettes. So you can see here that, again, our youth and young adults, they are really veering towards using e-cigarettes as their primary use or as their primary way to use tobacco products. And so that 3.6 million middle and high school students, that averages out to about 1 in 5. And then we do know that flavors are the reason why our teens are wanting to use these products. That's the reason that they keep coming back. And if you've seen any of these products on the shelves, or if you know of any students that are using e-cigarettes, you do know that they come in many different flavors. There's bubble gum, there's chocolate, there's even some that are cake. And our teens have told us that fruit, mint, and menthol flavors are among the most commonly used among them. And so here we have just a short video to show you guys sort of what Aspire looks like on the inside, and also to give just a little bit more information about what is actually in e-cigarettes. So I'll let Kathleen go ahead and play that video for us now.
E-cigarettes, vape pens, Juuls. They're often marketed as safe alternatives to smoking, but their cool designs, fun flavors, and the fact that they're easy to hide means it's not only smokers who want them, it's kids. And for kids, they're definitely not safe. Teens should absolutely not use Juuls, e-cigarettes, or any similar products. Here's why. When kids use Juuls or other e-cigarettes, they're getting a big dose of nicotine. This disrupts their brain development. It changes the connections between brain cells, causing problems with learning, mood, and impulse control. It makes depression and anxiety worse.
And as any smoker can tell you, nicotine is highly addictive. That makes it very difficult to quit e-cigarettes. And vaping makes it much more likely that kids will smoke real cigarettes later. It's true that a few e-cigarette brands don't contain nicotine, but most of them do. And all of them contain other dangerous chemicals like these. Formaldehyde, which is found in glue and embalming fluid. Diacetyl, which causes lung disease. Benzene, that's a carcinogen linked to leukemia. Some tests have also found metal particles in the e-cigarette vapor. The devices themselves can also be unsafe. They can explode.
The long-term effects of using e-cigarettes are unknown.
And because there are no standards, we don't know the ingredients in these products.
We don't want children to take unnecessary risks with their health
And begin a lifelong addiction to nicotine. Talk to your kids about e-cigarettes and how to say no to these harmful products.
So you can see so far from the information that we've presented and from that video, there is no safe tobacco product for our teens and high school students to use. But we do have some good news. If you're looking at these charts here or at the graphics here that are displayed, we're moving in the right direction. From 2019 to 2020, we are seeing a decrease overall in our students that are using tobacco products. So again, this is great progress. It's very promising, but it means that we need to continue doing what we're already doing, which is promoting more prevention resources and more prevention education to our students. So if you see here on the left-hand side, you can see that in 2019, 31% of high school students reported that they were using any tobacco product. And then on the right-hand side, you can see in 2020, that number actually dropped down to 23.6%. And that trend continues along with new products like e-cigarettes, and then some products that have been slowly gaining in popularity, such as hookah, and also with traditional products that have been on the market for a while, cigarettes, cigars, smokeless tobacco, and pipe. So again, we're moving in the right direction, but we want to continue this momentum and not slow down. So we do need to continue with our prevention resources. Now to hone in specifically on Texas, since most of us hail from the great state of Texas, we do want to highlight our youth tobacco rates here. So these numbers are taken from Tobacco-Free Kids. So if you are not in the state of Texas, you can go to their website and find out what your state looks like. But in the state of Texas, for our high school students who are current smokers, it's about at 5%. So that's over 80,000 high school students that are currently smoking and using tobacco products. To highlight cigars specifically, we know that male high school students use cigars at a much higher rate than female students. So there's about 6% of male high school students are currently using cigars. And then for our high school students that are using e-cigarettes, you see that we're at about 250,000. That's almost 250,000 students that are using e-cigarettes, so 18.7%. And for children under 18 in our state of Texas who become daily new smokers each year, that number is almost at 8,000 students or children who will become daily smokers as a result of experimenting with tobacco products. Now, for our adult population in Texas, the average rate is about 15% of adults who smoke. So if you'll remember in an earlier slide, we said that we're at about 20% nationally for adults who are smoking. So in Texas, it's just a little bit lower at 15%, but it's still very high. So that's about 3 million adults in our state that are currently smoking. And then for cancer deaths in Texas that are attributable to smoking, we are at 27%, which is a very, very high number. So that brings us to the Aspire program. So what is Aspire? It stands for a Smoking Prevention Interactive Experience, and it is an online educational resource. So we have found that in these times with the current pandemic, we have found that a lot of our teachers and educators are enjoying the fact that the program is online. It is tobacco prevention education. It's for teens and adolescents, and it is at a self-directed pace. My colleague Shamika will go into this a little bit more later, but the self-directed pace is another feature of the program that our educators do enjoy. They can kind of let their students sign up for the program, and then they can take a step back and have the students complete it at a pace that's either set for themselves or set by their teachers. And the program will take about 3 to 4 hours to complete with everything that is included. So what do students see and what do they learn throughout the program? Well, they travel through 5 interactive modules and they'll complete quizzes and tests along the way. So there are 5 interactive and educational modules. And after each of those modules, there is a quiz just to test students' understanding of the material that they have learned so far. And then before students begin the actual program, there is a pre-test just to judge where they are or test where they are with their knowledge with tobacco products. And then at the very end of the program, there is a post-test to gauge how much they have learned overall. And then during the program, students, they get to experience and see a lot of different perspectives from people who have been influenced by tobacco in their lives. And so they hear testimonials from healthcare professionals, MD Anderson professionals, and some of our providers here. They'll hear from former smokers, from cancer survivors, and then most importantly, they'll hear from their own peers about how they have navigated with loved ones using tobacco and peer pressure. So again, students get a wide variety of different perspectives that they get to listen to. The program was created by our researchers here at MD Anderson, so it is evidence-based and it does align with national education standards. So the program is TEKS aligned for those of you who are in Texas. The program is also bilingual, so it's available in both English and Spanish, and there are also closed captioning features available for hearing impaired students. And lastly, the program is provided completely free of charge. It is at no cost to students or educators. The only thing that we require for schools or youth-based organizations to join the program is for them to complete an agreement with us, but we can go into more detail with that if you have any questions. And then you'll see here in the picture, this is our avatar and main character for the program. Her name is Kia. So your students will travel along with Kia as she learns more about tobacco products, and we'll go into the educational or what's actually in each of the 5 modules in the next slides. So the Aspire modules, like I said, Aspire was created by our researchers here at MD Anderson. And so it does rely on 3 very sound models for behavioral change. So as students complete the program, they go on the journey with Kia. Kia first encounters tobacco through some of her friends, and then she is sort of catapulted into this gamification of tobacco prevention. And so in that first module, students will really start to understand some foundational aspects for tobacco products. So they'll get an overview of all the tobacco products that are currently available. And then the program does delve into how tobacco impacts the individual and also how it impacts people and places outside the individual. So that's everything from loved ones and friends and how it impacts your relationship with others and second and third hand smoke, and also the environmental aspect or the environmental impact of tobacco on the world around us. And in module 2, which is titled Temptation Cave, this module delves a little bit deeper into the underlying reasons why teens or even adults may begin to use tobacco, mostly as a coping mechanism, but students will travel with Kia and they'll go into Temptation Cave and they'll start to understand what triggers can cause someone to turn to tobacco products. They'll learn more about peer pressure and how that can influence a lot of teens to use tobacco products. They'll also learn how to say no to tobacco, and then they'll learn a little bit more about specific smoking-related diseases, including the 13 smoking-related cancers. And in Module 3, the Garden of Growth, this represents sort of a turning point after students have learned and after we've explained sort of a foundational approach or a foundational aspect of tobacco products. Students start to become more active and learn how they can avoid tobacco actively. And then also for students who are currently using tobacco, they'll be introduced to some steps that may help them quit if they are currently using tobacco or know loved ones that are using. And in Module 4, Chill Park, this is where students will learn more about how nicotine affects your brain and your mood. And they'll also be given some helpful tips to manage stress and anxiety. So some more effective, healthier coping skills than reaching for tobacco products. They'll also learn here some tips for communicating effectively with current tobacco users in their lives. And also here, there's more information on peer pressure and how to avoid using tobacco products. And then in our last educational module, Module 5, this is Oxygen City. And so it provides a recap of all tobacco products that have been covered so far. And then the program also does delve into a little bit what we talked about before with the tobacco industry and entertainment and how they really do attempt to cater to teens and young adults so that they can get them customers. So students will learn more about that, and then they'll also learn more about new and emerging products like e-cigarettes and synthetic marijuana, among others. And so how do we know that the program works? So we wanted to give you guys some information about the efficacy of the program. So it has been endorsed by the National Cancer Institute and also SAMHSA, the Substance Abuse and Mental Health Services Administration. But because the program was created by our researchers here at MD Anderson, we have had over 90% of students that complete the program do report an increase in knowledge of the harms that tobacco can cause. And they also report an increase in desire to lead a tobacco-free lifestyle. Now, in a study among students here in the Houston Independent School District, the students reported that they were 53 to 60% less likely to use tobacco and nicotine products after they completed the Aspire program. So again, we are seeing that our students, once they complete the program and they have learned about how harmful the products actually are, they are reporting that they have little to no desire to use the products anymore. And from January 2018 to July of 2020, in those pre and post assessment tests, we saw a 20% increase in knowledge for teens from before they started the program and knew, maybe a little about tobacco products or what they had heard from friends, increase in their knowledge by about 20%. And then for this last fall semester, August 2020 to December 2020, we had 5,000 students that were enrolled in the program. And over half of those students, 2,642 students, so about 53%, completed the program in its entirety from 160 schools across our nation. So with that, I will turn it over to my colleague, Shamika Johnson. She's going to give some more information about our current numbers for Aspire. And then she's also going to give you guys a little bit of a demonstration for our administrators and educators who may be interested in using the program.
Thank you, Kay. As Kay mentioned, I will discuss the numbers from Aspire and then introduce the Aspire student portal as well as the administrative portal. In January 2018, Aspire 2.0 was launched to include information on e-cigarette, hookah, and marijuana use. From January 2018 to July 2020, we had over 44 states to implement Aspire across 556 schools and programs, for a total number of 57,831 students enrolled in the program. During this current academic school year, next slide, please. During this current academic school year, from August 2020 to March 2021, there are currently 34 states enrolled in the Aspire program across 242 schools and programs, for a total number of 11,523 students enrolled. In order for students to enroll in the Aspire program, they will have to access the Aspire student portal. In the Aspire student portal, students will log in and create their own accounts and enroll in their respective schools and classes. The Aspire program delivers tobacco prevention education at a self-directed pace. Students can log in and log out without losing any activity, and their progress is immediately saved. In the event that a student forgets their password, a reset link can be sent to their email address. Once a student successfully completes the Aspire program, they can print their certificate of completion. And there's also a closed captioning feature available for the hearing impaired. In this illustration here, you'll see that students will be prompted to create a username. The username should be something identifiable by the teacher, as in this illustration, Kay Wallace. They would need a valid email address, they will confirm it, and they would also have to create a password and enter in their demographic information. In the next illustration, students will be prompted to enter their location information as well as their program and class periods. Once they do this, they can create an account. Once they create an account, the program is self-directed from that point. They will be prompted to take the pre-assessment, which is about 26 questions to gauge their knowledge. They'll take that same test at post. Usually at post, as we know, students do a lot better because they've had an opportunity to gain all the knowledge. Another important fact that we've learned, a lot of students, once they've gone through the Aspire program, they email us and ask us, why is this legal if it's so harmful to us? Because they had no idea that tobacco products and e-cigarettes were harmful. And so we have to be honest with them and let them know that it's just a numbers game, money. Big Tobacco cares nothing about them. They only care about getting our kids addicted. So it's very imperative, if you can, to implement this program. Next slide. So we talked about the student portal. So the administrative portal is where admins will go to access their accounts, to have access to the administrative dashboard. Program coordinators will provide login credentials at the time of sign up. As you can see in this snapshot, there are a total of 13 students in the program. Of that, 7 students have successfully completed and passed the program, 0 have failed, and 6 are in progress. I want to take a moment to let you know that Aspire Champions are educators that oversee the program at their school. They usually bring the program to their school, and location admins are staff members who will help and will have access only to their information and data, whereas a champion will have access to the whole picture at the school. This snapshot also provides information on demographic information as shown in the next slide. The demographic information is broken down by gender, age, and grade. All of the data in Aspire will belong to you. It's your data. One of the most important features of the administrative portal is the reporting system with grades, or the student report. As you can see highlighted here, these students have created usernames that are identifiable. There are 2 that decided to use Juicy Fruit and Bubblegum. So you won't know who those students are. So it's very imperative that you encourage your students to use identifying usernames. So when you run this report, you'll be able to identify your students. And as I said, the most important feature here is that you'll have access to all 7 student grades. Students will receive a grade for the pre-assessment, grades for each of the 5 modules, grades for the post-assessment. And on here, if you see NA, that just means the students are still working on that module and they hadn't made it to the next one yet. They're still in progress and they're still working on the program. In the next illustration, we ask in Aspire at the end of the program, we ask 4 evaluation questions consisting of, did you learn a new tobacco fact? Would you recommend Aspire? There are 4 evaluation questions, yes or no answers. Once students successfully complete the program, you will see that they've answered all 4 evaluation questions. Then they will be prompted to print their certificate of completion. And just as a recap, the Aspire Administrative Portal is the back-end database of Aspire. Login credentials are provided by the Aspire coordinator. There are 2 levels of access. Champion is the highest level of access. A program champion is a teacher or admin that will oversee the program at the school. Champions have the highest level of access and they will assign location admins to help them. Location admins are other teachers who will only have access to their class periods and their data from their respective classes. The dashboard allows you to see student enrollment and progress. Demographic information is provided and student reports with grades. Training is also provided at your request. And during the training, we'll take a deeper dive into the student portal and the administrative portal. Who uses Aspire? We recommend that anyone with direct access to you between the ages of 13 and 18 implement Aspire at their school. These administrators can consist of teachers, counselors, principals, assistant principals, nurses, health teachers, science teachers. Anyone, like I said, with direct access to you can implement Aspire in their schools or school districts. Here are a few testimonials from students and teachers and what they're saying about Aspire. You can take a moment to read over them. And I wanted to also add that because Aspire aligns with TEKS in science, health, and technology, A lot of our educators use Aspire as a grade for homework, final exam, test grades, homework grades, and for extra credit. From a seasonability standpoint, Aspire can also be used in observance of the tobacco observance days, such as Red Ribbon Week, Great American Smokeout, or World Tobacco Days. Next slide. So that's the wrap of Aspire. It is an educational resource, and we recommend that you do educate your students to raise awareness about tobacco and the harmful effects of tobacco. And so we do have another program called This is Quitting that will complement Aspire. So MD Anderson is proud to announce that today that we have a paid partnership with the Truth Initiative to extend and amplify our reach through a new program called This is Quitting. This is Quitting is made for youth between the ages of 13 and 18, and they receive help to receive help to quit vaping. And as a reminder, as Kay mentioned earlier, our e-cigarette rates in Texas is almost 20%. That's approximately 243,000 youth who are currently vaping. Any youth or young adult can access the program by texting Vape Free TX to 88709. It is a free 24-hour a day, 7-day a week confidential support to help them quit and work through their quit journey. We also have materials for parents and other adults who want to help young people quit, and they should text QUIT to 202-899-7550. We have social media material prepared for youth, by youth, focus group tested, and message appropriate for youth between the ages of 13 and 18. We have some examples here in the left-hand column, and we have materials created for parents and adults in the red graphic. If you want more information about this, you can email In Tobacco, and that email address is on the next slide. Here's also our contact information, my email address as well as Kay, and then we do have a general mailbox for Aspire. And as I said, for more information about This is Quitting material, you can email Jennifer Kofer at intobacco@mdanderson.org. We thank you for your time today. And if you have any questions, feel free to place them in the Q&A in the chat. Thank you.
Thank you so much, Kay and Shamika. That was fantastic. So as Shamika said, please go ahead and put your questions in the Q&A box so we can answer those live. We do already have a couple in the box, but I do want to share that we at Say What are super excited that we'll be partnering with MD Anderson and Aspire to promote this resource that they're discussing on this previous slide about being able to offer vaping cessation for youth using that Vape Free Texas code to put into texting. And so we're in the infancy stages of figuring out how we can work together to promote this throughout the state. So please, take a picture of this. This is a fantastic resource because we know that so many youth are struggling with serious addiction and they need help. And now we can finally offer them something that is geared more towards their age range. So with that, let's answer some questions. So the first one, it's a two-part question, I believe, from the same person. And the first part I can answer, and then the second part is for you, Kay and Shamika. So the first question is there any historical information about smoking in Texas? Looking for any alignment with Texas history curriculum. And so at Say What, we spent about a good year, a couple of years ago, putting together the history of tobacco prevention in Texas. It is an online training module. I'm going to drop that link into the chat for you all. It is extensive. We spent, like I said, like over a year interviewing numerous people. Dr. Victor DeNoble, he was also interviewed as well for his experiences in working with the tobacco industry a very long time ago, and what his experience and expertise he was able to provide. It's very engaging. It's video based. There is some reading, but it is mostly video based format. There are quizzes, there are activities. It's a lot of fun. It's hard to put the history of tobacco prevention into a format that seems to be fun and engaging, but I 100% agree that we did it. And I may be biased because it's the Say What program, but I promise you that anybody, whether you are an adolescent or an adult, will enjoy it. So you can check that out there at that link in there in the chat. The second question, do you have an outline of the curriculum and how each module aligns with TEKS?
So we can align it with TEKS. I believe this person from Texas, it is aligned with TEKS, and we can provide that information. The outline, the only thing that we have is the module specific information that's provided in the document.
Okay, and I'm more than happy to send that outline out at the end of our webinar along with the evaluation link. I'll make sure that that outline gets included. A chat did just pop up. Is there any programs available in Texas for disposal of e-cigarettes? There's a lot that is getting confiscated in school. So you are so intuitive, I must say, because we have been discussing at Say What, how we can put together some kind of downloadable guide, resource, kit, training, is something about the appropriate way to dispose of e-cigarettes because they are incredibly toxic to the environment. There's quite a bit of work that has to go into it before we can produce something and get it out to everybody. But the goal this year, within the next couple of months before school ends, is to offer that out, get that out there so school personnel can start planning for what to do with all of the e-cigarettes and other vape products that get collected or confiscated at school. Kay, Shamika, I don't know if there's anything that you wanted to add to that particular question.
It's exactly like you said. I know that we were also looking for that. We've had some teachers and educators reach out to us about it. I will say that we have noticed an increase in students that are using a lot of disposable e-cigarettes, ones that are made to be disposed of and used one time. But like you said, Kathleen, we know that people are working to put together programs outside of just some various places for information that you can look for, like the CDC and some other places. They do have some information out there, but programs are needed, and hopefully they are forthcoming very soon.
Yes, absolutely. It's probably a conversation for a couple of organizations to get together to figure out how best that we get this information out there, because the toxic level of it can't just be thrown in the trash. Okay, the next question. Have you compared the data from this program with YTS or YRBS? So the Youth Tobacco Survey or the Youth Risk Behavior Survey. I apologize if I messed that one up. Data for Texas or any other similar survey in other states?
So we have not done this yet, but that's a great question to ask us. So that is something that we do need to look into doing. But as of now, we haven't done that. Like I said earlier, we were in a bit of transition back last year with how our program was disseminated. So we are still doing an overall evaluation of the program. Whatever information we do have so far, again, with the efficacy of our program for students here in Texas and outside of it, we're happy to send that information out. But if you would like to email us with that question or any more specific questions you have about that, we could definitely get started on that, because again, that would be a great resource and great information for us to have. So thank you for that.
Great. So I don't see any other questions coming in, but we still have plenty of time. So we'll just take a moment to see if we get another question. But just as a reminder, where can everybody go to submit an inquiry? What is the process, I guess, to try and bring this particular curriculum to this?
So they can go to www.mdanderson.org/aspire. And we do have our inquiry form posted on the website. So that's where the initial inquiry is made. They will fill that form out and submit it. A program coordinator will be in contact with them within 15 to 20 minutes. And on that form, they can request a call, an informational call. They can request more information about Aspire. To get started, we will also send them the memorandum of understanding, as Kay mentioned before, partnership agreement. Once that partnership agreement is signed and returned, we can move forward with creating an account for the school or program. Just that simple.
Perfect. And I'm going to go ahead and put the link directly into the chat for you all. That has a good amount of information for you. It also has some downloadable resources for you. Correct? Is that correct, Kay and Shamika?
Yes, it is. What we did go over today with the module specific information, and then also that information about the efficacy of the program, those forms, those pages are available, and you can download those from the Aspire webpage. So thank you, Kathleen, for dropping that in there. You can also give us a call. You can give us a call, you can email us, and you can see all of that, how to contact us from our webpage. I did also want to mention, I don't think we mentioned this during our presentation, but in addition to the program being online, students can complete the program on any device. So they can use a smartphone, they can use tablets, traditional computers or laptops, anything with a screen and a smart screen, they can complete the program. So again, it's been a great resource as we've seen over the past year with the state of our schools and learning in general.
And I have a question for my own curiosity. I know that the previous years pre-COVID, things were drastically different versus now. So have you seen if any teachers have allowed students to go through a module during class time, or is it mostly assigned outside of class time as homework?
So for the most part, we do have a lot of districts that are implementing Aspire for the whole district. So students in 7th grade, 8th grade, 9th grade, 10th grade, and 11th grade, it's mandatory at some districts. So teachers do allow students time in class. We did have a phone call right before this meeting where we help students create accounts. And so usually teachers will allow 2 to 3 days of class time. And then they can also assign a portion of it for homework. And we have heard from parents when the program is assigned for homework, that can generate a discussion between the parent and the youth. And so parents were really excited to see that their teenagers are learning about vaping, because we know it's a huge issue. So we do encourage you, if you do have class time, it can also be used as a supplement to what is already being taught.
Great. And are there any activities for the student and the parent? Any discussion points? Is it mostly just directed at the student themselves?
Yes, so it's directed at the students. Yes.
Fantastic.
But it's kind of like sometimes it's a hard conversation to have. Parents don't know how to bring that topic up, the subject up. So Aspire is a great way to, like I said, generate a conversation. And educators are doing a wonderful job with educating our youth about this topic. But Aspire also drives the point home that education and awareness is definitely needed. And as I said earlier, we do hear back from kids wondering why, if this information or if the products is so detrimental, why is it legal? And so then, like, as I said, we have to let them know that it's just big tobacco's way of getting them addicted. They don't care about them personally. But at the same time, once they reach out, they're pretty much already addicted. So we're glad to have this partnership with This Is Quitting to address the cessation piece.
Yes, and I want to add on to what Shamika is saying and what you asked Kathleen about resources for parents. This is one reason why we have partnered with This Is Quitting. Like Shamika did say, there is a number specifically for parents and educators and other adults to text. And so they can be enrolled in their own sort of text program to learn more about how they can have healthy and productive conversations with their teens and with their adolescents. So that's a great exercise to do. I did it a couple months back just to see the type of messages that parents and teachers can get. And so that is one reason why we have partnered with them. We know that a lot of resources are needed to make sure that we're covering all the ground that we need to. And so that is one way for parents to get involved, along with watching the Aspire program with their students, and maybe just asking them, what did you learn today? How do you feel about tobacco now, or e-cigarettes now after you've gone through the program? So there are resources available. And as we come across more resources, we are, sending those out to all of our partners. And we know that you guys are doing the same.
And another question out of curiosity for me, so when a school year ends, does a teacher or school administrator have to reach back out and start things over, or is it a continuous thing where they have access to implement each school year?
So yes, at the end of each semester, we will go in and deactivate or archive all the data. And then for the upcoming semester, we will set them up to begin for the next semester. They would simply send us their classroom information and we will put that into the system. And so when students log into the student portal to create their accounts, they'll have the ability to select their program and their respective class periods.
Great. This is a fantastic resource. I'm genuinely so excited that we were able to have the both of you on and to share this free resource with everybody that has attended. And like I mentioned earlier, there will be a recording, and a recording will be available and you will receive the link to that. And so please, I want to ask you to share that with all of your colleagues or anybody else at the school you think it's relevant for them to have, whether it's a school resource officer or a school nurse or another teacher. We're all in this together so that we can try and educate our youth and get those who need help, the help they need to get off of nicotine products. So with that, we are going to end with 9 minutes left back for you for your day. I hope you enjoy the rest of your Tuesday. Please be on the lookout for an evaluation link because that will be coming your way, and we'll go ahead and still include that outline of the Aspire modules for you all as well. So thank you, everybody, and enjoy the rest of your day.